Some of the most exciting breakthroughs are happening in the field of medicine. Let's explore one promising example.
From the Eiffel Tower to the wings of airplanes to bridges all across the globe, many structures are built using truss designs. The intricate triangular truss design is now making an impact in a completely new area, the medical community. A growing number of spine surgeons are utilizing a revolutionary patented implant based on truss designs to treat patients with degenerative disc disease in an entirely new way. Developed by Jesse Hunt, founder and president of 4WEBMed, this new type of device is an effective alternative for performing spinal fusion surgeries.
When patients show up at the doctor's office, the doctors will typically take them through pretty conservative treatments, physical therapy, pain medications, to try to resolve the issue. In fact, they may have even gone through a minor procedure to try to correct the issue. It's not until the very end, when the pain is debilitating and the patients can't perform their day-to-day functions, that spinal fusion surgery becomes necessary.
The company's first three products, the 4WEBMed A-Lift Spine Truss System, the Cervical Spine Truss System, and the Posterior Spine Truss System, are all FDA cleared.
We're currently producing and going to market with 3 or 4 more designs that will complete our spine offering.
Typically, when using traditional implant technologies, expensive biologics are used to achieve a strong fusion. Unlike conventional implant technologies, 4WEBMed's truss design provides excellent support and more open space throughout the implant to facilitate bone regeneration and fusion.
Ultimately, what we can do is we can program the implants to have a very specific distribution of strain inside the implant, which has the potential to stimulate an osteogenic response and also potentially accelerate the healing process.
Surgeons using 4WEBMed's truss implant technology perform spinal fusion surgery using the same techniques as alternative spine implants that are commonly available.
This means a lot to the working individual. I have a patient that's a fireman and he needed to go back to fireman duties, and I told him he could go back in 3 months, and sure enough, he was back to work 3 months on no medications and doing his job as a fireman. And that's a pretty big testament to speaking to the stability of the construct when you build with 4WEB technology.
Work in topological dimension theory led to the discovery of a geometry called the 4WEB. 4WEB can be used as a building block to create high-strength, lightweight web structures. We utilize this technology to build orthopedic implants that have a very open architecture and provide structural support while osseous incorporation takes place.
The concept behind the unique architectural design enables the implant to act as an active participant in the healing process, rather than a static spacer that merely separates the vertebrae, as with most traditional implants.
I'm a firefighter paramedic. Back on September 1st, 2008, I was injured in the line of duty at a structure fire. Ruptured disc in my back. Fought with that injury for about 5 or 6 years. I was contemplating quitting the fire service. Met Dr. Carmody. He introduced me to the 4WEB technology, the implant. So we talked about all the pros and cons. Went ahead and decided to do it, and had the surgery. And 93 days later, to be exact, I was back on a rig, 100% capable, comfortable with my job, and happier than ever.
In addition to helping restore patient quality of life, 4WEBMed and its spine truss implants could also help to cut down on immediate surgical costs and potential costs down the road.
The health benefits of the truss technology, or the economic benefits, are that we do less repeat surgery. Surgery is expensive, and it's particularly expensive if there's a complication. We seem to get much quicker, rapid bone healing. Patients get better faster. It used to be 3 to 6 months to get somebody back to work after a fusion operation. Now it's more of like weeks. And that's been pretty consistent with all the users I've spoken to and my own experience with the implant. So we think it not only heals faster, we have x-ray evidence that it's doing that, and then we have the clinical evidence that people are getting back to work quite a bit faster than in the past.
4WEBMed's truss implant technology provides surgeons and patients with an innovative, effective option that's unlike anything else on the market today.